talk to 10 people about mental health today.
World Mental Health Day under the theme, it is time to prioritize mental health at the workplace.
Tomorrow is World Mental Health Day.
But we often see that 1%, which are those who are walking on our street.
So this is how bad drugs can actually be used.
Shisha is now taking the lead, and young ladies are leading when it comes to
suicide. We have about 800,000 deaths globally every year. Hello everyone, you're welcome to another video. So this month, apart from it being breast cancer awareness month, October, on the 10th of this month too is mental health awareness day. Yes, so with this I decided to interview one of our lecturers who is into mental health, and then so that he give us more information about this particular sector. So he's a clinical health psychologist, and then he works as a visiting psychologist at Tamale Teaching Hospital. He's also the head of department for the psychology units in UDS, and then also the vice president of the Ghana Association of Psychologists. He is also a mental health advocate, and then the founder of the first psychology clinic in northern Ghana, which is called the Total Life Enhancement Center Ghana. That's the Tulek Ghana. Yes. So this person is in the name of Mr. Peter Minter Amadou. So you're welcome to today's session.
Thank you.
And then thank you so much for accepting to do this with us. And then we are really grateful.
Thank you. It's a pleasure.
Okay, so first of all, I would like us to talk about the mental health situation, globally and then down to Ghana. How is people's attitude towards mental health? What has been the advancements that have been made in mental health, and how far we have come with mental health?
Thank you very much for this opportunity to support you in educating your audience. Yes, so mental health is an area of need. I will say long neglected, not so much attention has been given to it, but at least we have come from somewhere, and we are surely making giant strides towards prioritizing our mental health. But before I look at the situation of mental health, let me put into perspective some few concepts by the World Health Organization when it comes to the whole domain of health. You know, in 1948, the World Health Organization in their meeting came out with a definition to guide our concept of health, anything at all we were engaging on that. And they said that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. This definition underscores three major principles, or three major concepts when we talk about health: physical health, mental health, and social health. So that means that each of us, to be holistically healthy, we need to have these things in equilibrium. That makes this definition even more difficult to satisfy. But no matter what, it's still a definition that we have been pushing and hoping that all of us will try to have a balance in all these three dimensions of health. But when it comes to physical health, I must admit, as a people, we really have done well in terms of human resource, in terms of infrastructure, in terms of equipment, whatever it is. But the aspect that we have really not done well is mental health. And that aspect is what I often would call the long neglected aspect of health. The greatest need of our time, often not so much attention has been given to it, is mental health. And the same WHO also said that for one to be mentally healthy, they talk about a number of things. They say mental health is a state of well-being where the individual knows his or her ability, can cope with the normal stresses of life, work productively, and contribute to his or her environment. So basically, it means that for one to be mentally healthy, we're talking about ability. Who am I? We're talking about coping skills. We're talking about productivity and enhancement of life. And then we're talking about contribution to your community. The community is vast. It could be the immediate family, it could be the workplace, it could be a school. And mental health simply means that what we have, we need to protect. So mental health emphasizes the fact that there's the need, we have a certain level of functionality which we need to protect. And if we fail to protect that, what it means is that that functionality can be lost. Losing of that functionality can lead us to what we call mental illness. So this is actually where we need to pay attention. The illness is an aspect where we, especially those in the area of mental health advocacy, all that to say that I am healthy today, I am thinking well today, I am feeling well today, and I'm behaving well. I don't want anything to disrupt that. And if there are things that will disrupt it, we will show you what to do to stay healthy. Often we'll say that when we talk about mental health, we're talking about thinking, feeling, and behavior. That is mental health. Am I thinking well? Am I feeling well? Am I behaving well? This is mental health. So anything at all, my thinking is at variance with what is normal. Check your mental health. Anything at all, my feeling is at variance with what should be normal. Check your mental health. And anything at all, my behavior. That behavior could be the substance use. That behavior could be the hoarding. That behavior could be gambling. Check your mental health.
So in a society where we are so much rooted in spiritual religion and culture, we kind of don't appreciate this kind of explanations to our normal happening. Somebody is talking anyhow, we think that the person has been possessed and all of that. So what's the attitude of people to mental health? How is it like dealing with people and their mental health in this setting?
Take it from the Ghanaian perspective first before coming to the modern. So from the Ghanaian perspective, I must admit that we have really made giant strides since 2012 up to now. And a lot of energy has been put into expanding mental health services. But that is not to say they are no challenges. So when you come to look at infrastructure, you come to look at professionals, you come to look at literacy levels, and you come to look at funding. There are huge gaps here that we can talk about looking for support. But that huge gap means that we really, as a people, have paid so much attention. Because when you even come to budgetary allocation, not so much when we talk about mental health, and not so much when we talk about other aspects of our mental well-being. And so from the national level to the regional level, the picture is not different. So even within the northern region, when it comes to professionals, they are really not adequate. We come to infrastructure, we can't boast to say that we have well-resourced mental health facilities. When we come to the issues of literacy, many of our people, everything about mental health, because we are unable to explain and we don't even have the personnel to help us, everything is spiritual, just like we are saying. So it means that for one thing we don't appreciate very much is that then we don't push it to what? Spirituality and give it name. And so at the end of the day, it fits in very well. But the truth is that some individuals who are actually having a lot of mental health related challenges often are misdiagnosed, often are misunderstood, and so even the treatment process is not the best for them.
Particular behavior, we shouldn't attribute it to that because there are scientific explanations for all these behaviors, and when you come here, they are going to. People have actually come and have gotten treatment, so that means there's a way out, and then we shouldn't attribute those things to our natural happiness. Yes. So here, Amy, you have practiced for a period now, for a very long time. So I just want us to know the most prevalent mental health issues. What are the disorders that are more seen in our hospitals every day or in our society?
Yeah. So within our health facilities, call it the top 5, the top 4, the top 10 that we do as we quarterly give report is depression. Depression is number 1. Anxiety, substance use, post-traumatic stress disorders, issues of suicide, conduct disorder, adjustment disorder, attention deficit hyperactivity, acute stress related challenges, and then a greater part of it, these we call the major issues that I would say myself and my colleagues, because at the end of the day, when we generate the report, it's not a report that is, because these are the things that we see. So in a week, when we see like 10 people, 6, 7 of them could probably go in for a diagnosis of depression. And that tells you how prevalent it is. And globally, depression is one mental health condition that is largely leading the chart, or as the footballers would say, the league table when it comes to mental health issues. So it is something that is great enough. Also, beyond the consulting room, literature also points to these things. There was a research done recently in Ghana looking at the mental health landscape in Ghana. And number 3 among their top 3 when it comes to mental health issues, especially among the youth, had to do with depression, substance use, and anxiety. So that also underscores what we see in the consulting room. So the reflection in the consulting room is data driven. Data driven, another person sitting somewhere did his research, and then they found that depression was number 1 when it comes to issues of young people. And the majority of them who come into therapy are young people.